information you need to know.
Your friend in Central Illinois. WHOW.
Top of the morning. Thanks for being with us. I'm your host today, Seth Lawrence. The WHOW Morning Show streams to Facebook and YouTube, brought to you by Peterson Insurance, your Pekin Insurance agent in Clinton. My guest on the Zoom today is Steve Tenhouse. He is the CEO of Kirby Medical Center in Monticello. Steve, a good morning to you, sir. How are you today?
Morning, Seth. I'm doing fine.
Very good. Thanks for taking time for us. Always good to have you on the program. And it's been a while, Steve, since we've had you on the program. And if folks drive by that Kirby Medical Center facility there in Monticello, if they've not been there for a while, it's going to look vastly different. You've really done a lot of things over the last several years. We're going to talk about some of the new things in the last several months. But first, tell me about the growth of your facility there in Monticello. What's been the key to it? What have you been up to? How about some of those things to get us started today?
Yeah, it's amazing. It'll be 15 years we've been here at the new campus in September, which doesn't seem possible. And you're right, the campus has changed a lot in that 15 years, particularly with the addition of our therapy and wellness center that we opened up a few years ago. And our therapy department has grown tremendously since we've added the space and increased the access for our patients. Mm-hmm. One thing that we're really excited about that we just started about a month ago is pediatric therapy, physical, occupational, and speech therapy. It's a much needed service here in this area, and serves an at-risk pediatric population where getting those skills and built early are really important, and we're so excited to offer that service now.
Yeah, definitely. What are some of the what are some of the advancements and services at your facility over the last several years? Any new things that you've been able to bring along and provide for the community there?
Sure. Quite a few. If we try to look back 15 years and think everything that we've done, it's a
long list, I'm sure.
It is, but we're celebrating our 10th anniversary of our CrossFit gym here on campus.
Oh, wow.
And this summer and moved our CrossFit gym into our therapy and wellness center when it opened a few years ago to give us a little more space, mm-hmm. as well as to use our old gym for our facilities and maintenance garage. Mm. But we have a full-time general surgeon here now. We have orthopedics here on a daily basis. We're doing hip replacements now. Wow. And shoulder replacements, knee replacements. So it has just been great offering that to the community, and that we weren't able to offer before. Mm-hmm. And it's wonderful seeing the community be able to take advantage of it.
Yeah, definitely. And it's interesting. Not a lot of communities the size of Monticello have the opportunity for access to the healthcare that you're talking about there. How about just the ability to not only provide that for the community, but decide what is next, and where does your healthcare in Monticello take you next? How do you make those decisions?
Well, I think as far as us as a hospital, kind of what's next is that really is driven by how the community changes and what those needs are, as well as the advancements in medicine. Hip replacements now, you go home the next day. Mm-hmm. So the opportunity that we had to provide that, kind of came about as that technology and improvements in medicine happened. For us, we just, we pay close attention to the market data. We pay close attention to what the patients are asking for, and then just sit down and figure out how we can make that happen. We brought MRI here, magnetic resonance imaging technology. It's been 20 years ago, and have always had a mobile unit here. And to begin with, once a week, and now we have it here full time, and we're actually in the process of putting in a fixed MRI inside the building right now, and that will be done at the end of May. Mm-hmm. So much better, more convenient space and experience for the patients we're pretty excited about.
Sure. In terms of technology, that was kind of something that came to my mind as you were speaking there about what you're doing with imaging. How has Kirby Medical Center there in Monticello been able to keep up with the latest in technology in healthcare? Because, like technology everywhere else, it's constantly changing. How about that side of it?
It is. And the upside is that, technology has improved and fortunately at the same time, cost have remained steady, even come down a little bit. So, the cost of a CT scanner or an MRI 15 years ago, considerably more than it is now, but the technology's improved.
Mm-hmm.
So again, for a hospital our size, that we like to take advantage of that when we can, and again, get the technology that the patients need, that our ER doctors, our primary care doctors need for their patients, and it's been great, and it's been wonderful having the space to be able to do that expansion and to offer more of those services to the community.
Sure. Very good. Again, Steve Tenhouse is the CEO of the Kirby Medical Center in Monticello, our guest here on the Zoom this morning. And, Steve, you mentioned some of those new services that that Kirby has been able to provide in recent months. You mentioned, was it pediatric orthopedics? Was that right?
Pediatric therapy.
Pediatric therapy.
Yeah.
Tell me about that service. What's that look like?
So that's physical, occupational, and speech therapy for kids.
Mm-hmm.
And it is in some instances very similar to those same services that adults get, but for kids, it's even more important because it's both training on both gross and fine motor skills.
Mm-hmm.
So for occupational therapy, it's how to hold a pencil, how to hold a crayon, how to button your shirt. Physical therapy is more about movement and strength. So, if kids are slow to walk or having issues walking, our therapists can work with them. And speech therapy is really important. As a child, building those abilities early is what carries you through in life.
Right.
And, we can help children with eating. We can, again, help them articulate. It's a population that is very much at risk and probably the most rewarding when you see the difference that you make.
Mm-hmm. Sure. When it comes to that service, is there an increased need in some of these things in kids these days?
Definitely, because we're seeing some of these services close down around us. So we're starting to actually see a population kind of come into Monticello for that because they can't get in anywhere else.
Yeah.
Or the wait times are high. And if you have a child who is struggling with eating, those are skills that you can't wait 4 weeks, 3 months to get them seen. They need to be seen right away and need to be worked with.
Yeah. I didn't realize there was a need through basically attrition on those services that they were closing down and people are coming into Monticello. That got me wondering though, Mr. Tenhouse, is what is the what do you think the numbers look like in terms of people coming to Kirby from other communities? I'm sure you get people coming to Kirby from like Bemint and Cerro Gordo and those places, but are they coming from farther away than Piatt County for some of your services?
Sure, we see a lot of patients from Macon County and Champaign County coming here for a number of things. We've definitely seen an increase in our quick care volumes and our emergency department volumes over the years. And a lot of that has been from other areas. And some of those areas, healthcare has struggled. And I think that's part of the reason why. So, we've had to focus a lot on what our growth needs are, what we need to expand into and manage, and try to do it right so that we don't overcorrect for some of those volumes that we're seeing, but still make sure we're taking care of the patients that are coming here from out of from other communities, as well as our patients right here in Piatt County.
Sure. Any other services to highlight, Steve, that are new to the Kirby Medical Center there in Monticello?
Just getting ready to open up our specific orthopedic space for our orthopedic surgeons and our orthopedic mid-level providers. They'll have their own X-ray suite and they'll have their own exam rooms, and that will free up more room in our Kirby Medical Group for us to hire in another primary care doctor. Okay. And actively recruiting for that right now, and looking forward to adding that and again, taking care of the patients here in the county.
Very good. Well, Steve, how do folks follow along with Kirby Medical Center and all the things you have going on, or where do they learn about the services there at Kirby Medical Center in Monticello? How do they keep track of everything you've got and learn more about those things?
Sure. Just through your typical channels, through social media, through our website, kirbyhealth.org. You can follow us on Facebook, Instagram, And again, we're a small hospital. Pick up the phone and just call, and somebody would be happy to talk to you about what we have to offer and how we can help.
I tell you what, Steve, on the other side of the break, let's dive into that a little bit more. That kind of hometown personal touch. You've got the service, you have the services and amenities of the larger corporations, if you will, but you've got the service and the hospitality, if you will, of that small town feel. Let's maybe dive into that a little more on the other side of the break. Again, Mr. Steve Tenhouse is the CEO of Kirby Medical Center in Monticello, our guest on the Zoom today. More to come with Steve on the WHOW Morning Show.
WHOW.
Let's check the opening numbers now at the Chicago Board of Trade on this